Welcome. Lyme disease has emerged as a major public health issue in recent years. Due to its increasing prevalence, the complexity of diagnosing it, and the diversity of symptoms it can cause, indeed. So the major challenge is precisely this complexity, which often makes the disease difficult to detect and therefore to treat. I have the honor of meeting with Dr. SCHMITZ to shed light on this disease for you. So, Dr. SCHMITZ, you are a reference in this pathology, but more broadly in autoimmune diseases, with your approach to natural health. We can mention homeopathy, phytoaromatherapy, nutritherapy, nutritional supplements, Vincent's bioelectronics, and many others that we will discuss tonight. These tools are no longer a secret to you, which allows you to have a new vision and approach in the treatment of Lyme disease in particular. So, doctor, without further ado, what is Lyme disease?
Thank you. So indeed, Lyme disease is an illness that is transmitted by ticks of the species Ixodes ricinus, which is also known as the sheep tick, which are known to effectively and efficiently transmit the well-known and widely recognized bacteria called Borrelia burgdorferi. These are indeed somewhat complicated terms, but they are the scientific terms. This bacterium, which is commonly transmitted to humans through a tick bite, the risk of transmission of this bacterium, this Borrelia, increases with the duration of attachment of the infected tick and appears low when the tick is removed within approximately 12 to 24 hours. So this is a very important first notion for all walkers, indeed all people who go for walks in the woods. When you return from your walk, first carefully inspect yourself, and if you see a tick, remove it if possible within 12 to 24 hours to avoid future problems. Examine thoroughly. So this infection caused by Borrelia is not spread from one person to another, which is also important to know. It is only transmitted from the infected tick to humans. An infection by the bacteria in the past or currently still active does not confer protective immunity. It is therefore indeed possible to be infected multiple times, so this is also an important point to know. So, where can we find these famous ticks? Well, don't believe everything you hear, because we've read a lot, for example, that in France the risk of infection is mainly in Alsace. Well, that's not true. We have ticks everywhere, whether in Belgium, Switzerland, France, all over France. And one can be infected by a tick in Nice, for example. You don't necessarily have to be in Alsace. In fact, it is indeed important to know that ticks prefer a humid environment that is favorable for their survival, so they are mostly found in shaded areas, in low vegetation, leaf litter, tall grasses, bushes, and generally speaking, all wooded regions with vegetation, including deciduous forests and coniferous forests. So this tick bite occurs when walking in the forest, but it can also happen in meadows, dunes, urban green spaces, or even in your own garden. Therefore, you don't have to be walking in the forest to be bitten by a tick, such as in meadows, dunes, or urban green spaces. So when are ticks typically active? Well, they can generally be found all year round, but they are usually most active when the temperature is at least 10 to 12 degrees. Therefore, in regions with a temperate climate and variable seasons, such as Belgium or northern France, ticks are typically mainly active between spring and autumn, that is, from March to October, and when it is usually warm and humid. So, to some extent, indeed alleviate concerns, it is important to know that not every tick bite is infectious. For example, in Belgium, only 10% of the ticks are. Ticks are indeed infected. An infected tick does not necessarily transmit the bacteria, and an infected person does not necessarily develop the disease. And Lyme disease can be effectively treated with antibiotics, which we will discuss later in the treatment section, if it is diagnosed in a timely manner. So, it is important to know that this disease concerns everyone, but it will particularly affect people who are regularly in contact with nature due to their profession or leisure activities. For example, we think of all the people who work in forests, such as hikers, landscapers, and also farmers. So that's what we can say about the transmission, in essence.
So, what are the different symptoms, and how can one realize that they have been bitten and infected by a tick?
So the symptoms, and this is what can sometimes indeed be a bit complicated, can be very different from one person to another. After a tick bite, the risk of developing Lyme disease is typically approximately 1 to 2%. If Lyme disease develops, it can present with various symptoms and manifestations, such as affecting the skin, joints, or even the nervous system. And above all, the symptoms vary from person to person and can indeed appear after a more or less extended period. So we have what are indeed called early manifestations, which are actually the first symptoms. The most common early manifestation, typically observed in 60 to 80% of cases, is the well-known erythema migrans, which usually appears between 2 and 30 days after the tick bite. So, what is this migratory rash? On your skin, you will observe a kind of red ring that gradually expands from the site of the bite, often with a clearing in the center. This migratory rash is not painful and disappears spontaneously within a few weeks. Therefore, and this is the trap as well, it can go unnoticed. Of course, it is important to distinguish between erythema migrans and the temporary localized redness that can occur immediately after the bite. Erythema migrans, which is a characteristic symptom of Lyme disease. Its presence is indeed enough to make the diagnosis and start antibiotic treatment as soon as possible, which will prevent the progression of the disease. So, of course, one can have flu-like symptoms such as a mild fever, fatigue, muscle aches, and perhaps headaches. All of this can initially be associated with the well-known and commonly recognized erythema migrans. These are the early and initial manifestations. Later on, more delayed and prolonged manifestations can be observed, which can appear several months or even many years after the tick bite, even in the complete absence of a prior erythema migrans. If the infection is not treated, the bacteria can spread throughout the body and affect various organs, including the skin, joints, nervous system, and even the heart. Depending on the affected organ, such as the heart or lungs, the following symptoms may be observed. Of course, one can always have a migrant heritage, which can definitely, undoubtedly, sometimes be multiple. There are cases of arthritis, which means inflammation of a joint. Neurological involvement can also occur. One can have radiculitis, which are inflammations of the nerve roots, particularly in the back. One can even have meningitis, an inflammation of the membrane surrounding the brain. One can even experience heart rhythm disorders, also known as arrhythmias. And in my professional experience, I think of a specific individual I treated in one of my many centers. This person who, due to Lyme disease, was gradually and slowly becoming blind, thus their field of vision was narrowing. We also have what some call post-Lyme syndrome, which is commonly referred to as post-Lyme syndrome. Therefore, some patients who have had well-treated Lyme disease suffer from a set of non-specific symptoms such as very vague pains, concentration problems, and headaches, which are described as the infamous post-Lyme syndrome, and the exact cause is currently not yet known. So these are the signs, the symptoms that you should definitely be aware of and recognize. Now let's talk about the test to see if we really have this disease and how we can effectively diagnose Lyme disease. We'll review the steps to ensure an accurate diagnosis. As I told you, as you are aware, the most important point is the extremely well-known erythema migrans, which is, in fact, the only symptom that indeed allows for the diagnosis of Lyme disease without any additional testing, Lyme disease. So it is actually this famous red ring on the skin that will gradually spread from the site of the bite. In the absence of a migratory erythema, other later symptoms that I have already mentioned, such as facial paralysis, joint inflammation, and heart problems, can indeed raise suspicion of Lyme disease, which will actually be confirmed through a blood test. The blood test will therefore detect what are called antibodies against the specific Borrelia bacteria in the bloodstream. If they are indeed present, they are even an indication of recent or past contact with the bacteria. Therefore, a blood test is indeed only truly useful 6 weeks after a tick bite. When you are bitten by a tick, there is no point in rushing to get a blood test right away. It's too early. Wait 6 weeks. And then what are we looking for? Early antibodies, what we generally call IgM, typically between 2 and 4 weeks after a tick bite, with a peak usually between the 6th and 8th week. Those are the early antibodies. And then we have the late antibodies, which are called immunoglobulin G, IgG, typically appear approximately between 6 to 8 weeks following a tick bite infection and can decrease very slowly or persist even for years. If the result of this blood test is positive, a second confirmation test, such as a differentiation test, sometimes called the Western blot, can be done because, unfortunately, the first test I mentioned earlier gives quite a few false positives. If the result of the second blood test is positive, or if symptoms are present, in that particular case, one should start antibiotic treatment without any hesitation. However, this diagnosis presents certain difficulties. So why? Because some people who develop Lyme disease do not remember being bitten by a tick. Lyme disease symptoms can be varied and sometimes take a while to appear. Ticks are often very small and can go unnoticed. Localized reactions that can often appear immediately after a tick bite can sometimes be mistakenly mistaken for a migrating skin rash. The symptoms can indeed be very diverse and vary from one person to another. The blood test should not, as I mentioned, be done too early because at the beginning of the infection, the antibodies are not yet detectable, and therefore you are at high risk of getting false negatives. The immune system produces antibodies for months or even years after an infection, including after antibiotic treatment, and a test can therefore still show their presence even when the disease is cured. So you see, as you might imagine, it's a bit complicated to navigate and understand the process of the tests and diagnosis of Lyme disease, which can be quite challenging. As I told you, remember that the really crucial and very important sign after a tick bite is looking for this erythema migrans that appears on the skin, and in particular, it is significant.
So, doctor, when we talk about Lyme disease, co-infection is often mentioned. Can you tell us a bit more about this topic, about this point of co-infection?
So, if you talk about Lyme disease to a doctor or even a specialist such as an infectious disease expert, for them, they only know about the erythema migrans, the pain associated with tick bites, and also a positive serology. However, it is known that this serology is not reliable. Indeed, it is not very sensitive and often actually reports what are often called false negatives. The real problem, which is indeed absolutely not being adequately assessed at the moment, is the fact that ticks inject much more than just Borrelia, the Borrelia bacteria, in fact. Indeed, ticks can carry dozens of different microbes, such as bacteria, viruses, and protozoa, and are often themselves multi-infected. This means that a tick can potentially inject you with Borrelia, but it may also inject you with various other microbes that will further complicate the medical situation. Alternatively, in the case of a tick bite, you may be free of any Borrelia, meaning you have not contracted Lyme disease, but you may have been infected by other microbes. That is why, indeed, Lyme disease is frequently referred to as the tip of the iceberg, or the tree that hides the forest. Because as this disease becomes more and more frequent, co-infections transmitted by ticks are also on the rise. And if Lyme disease is already extremely difficult to diagnose, it requires highly advanced, very complicated tests that only a few specialized laboratories in the world are capable of performing. In Belgium, we are indeed very fortunate to have the Red Labs laboratory, which is highly specialized in this type of research and extremely important. Unfortunately, in France, they are significantly more diminished, and that is why Lyme disease and these co-infections are often misdiagnosed, particularly in France. So let's talk about some of the main co-infections, because there are some that stand out, that are important and need to be discussed. So what should you look for when dealing with Lyme disease? What co-infections should you be aware of? Well, you have what are known as the infamous Babesias. Babesias are protozoa, which means they are species of parasites that infect red blood cells and can be considered cousins of Plasmodium, the organism responsible for malaria. They present many of the symptoms and signs of Lyme disease, with a highly indicative sign being unexplained night sweats, not caused by hot flashes or fever. After the Babesias, there is another family called the Rickettsia, which is a large family of bacteria transmitted by various animals and insects. In France, we are particularly familiar with what is also known as Mediterranean spotted fever, which is transmitted to humans by the bite of the dog tick. These intracellular bacteria do not often cause fever, which is why they are also typically and commonly referred to as cold infections, but with extremely variable symptoms, often related to inflammation of the small vessels and known as microvasculitis. So as you can clearly see, there are already quite a few co-infections already present, but that is not the entire story. We talked about Babesias. We could also mention various types of organisms such as chlamydias and mycoplasmas. These are two species that are primarily sought in cases of genital infections, as they are part of sexually transmitted diseases, but there are others responsible for respiratory infections. The main problem with these microbes is that they hide in our cells, making them very difficult to eradicate, even though they cause very persistent chronic infections. After Babesia, Rickettsia, Chlamydia, Mycoplasma, we don't have everything and the list keeps growing. We also have Bartonella, which is well known in France for causing cat scratch disease or Bartonellosis. However, there are several species of Bartonella that come from other animals, such as dogs and rodents. Ticks can carry it, but so can chickens, fleas, and even some mosquitoes also. Finally, more well known are the famous candidiasis infections, as the candidate is often involved in what are called cold infections, even though it is not transmitted by ethics. We are talking here about mycosis or intestinal candidiasis, terms that are quite similar to describe the abnormal growth of yeast in the intestine, but sometimes also in other parts of the body. And finally, to conclude this list of possible co-infections, certain viruses must indeed also be mentioned. The viruses we systematically and methodically look for are those from the herpes virus family, as they share a common characteristic. They are capable of hiding in different parts of the body and re-emerging periodically, such as regularly, creating chronic infectious syndromes. But you don't only have herpes, there are also two other things, such as, and additionally, that you should be aware of, that are very important to look for. Potentially, it's the famous EBV, what we call the Epstein-Barr virus, which is the virus of mononucleosis, or also the cytomegalovirus, which is a virus that doesn't cause a very noticeable infection, but can cause a mild infection. So, we are dealing with the whole issue of Lyme, a stealth infection, where everything can somewhat mix together, which further complicates the problem significantly. In an effort to assist with navigating the complex and confusing maze of Lyme disease and cold infections, I tried to create a comprehensive summary table. This table is designed to help clarify. I would say there are 4 main categories: viruses, parasites, candida, a type of yeast, and bacteria, including the well-known Lyme bacterium. Viruses generally cause few general symptoms, unlike parasites, candida, and Lyme disease, where fatigue is indeed a distinctive symptom. Viruses tend to cause very few digestive symptoms, in contrast to parasites, which often result in diarrhea or constipation. Candida, a yeast infection, can lead to gastric spasms or occasional constipation. Lyme disease, however, is particularly known for producing excessive gas and very odorous stools. Then you have the large family of all muscle pains and symptoms, which are very rare with viruses, but very common in parasitic infections, such as with Candida and of course with Lyme disease, where you experience tremors, cramps, and a lot of pain. You have all the various vascular symptoms or the different skin symptoms, which can sometimes vary depending on the types of viruses and are extremely rare with the parasite. With candidiasis or candida, you often have redness and itching around the anus or in the armpits or under the arms. You might often experience these symptoms. And with Lyme disease, you often have cold extremities and a sensitivity to cold. These are very characteristic signs of Lyme disease. And then, let's not forget the neurological symptoms that can be found, of course, with viruses, particularly shingles, for example, which is well known. Candida albicans will often give you a kind of significant brain fog. And unfortunately, Lyme disease, which is a serious and often debilitating condition, can also cause this sensation of brain fog, intellectual fog, even leading to neuropathies. Then you have other more specific symptoms, such as, for example, like headaches or dizziness. With viruses, you have swollen lymph nodes, a lymph node involvement. You look for them under the arms or in the groin. For Candida, there is a distinctive and notable symptom, which is the attraction of people infected with Candida to sugar. And in Lyme disease, as I have previously mentioned, a characteristic symptom is palpitations. So you see, it's extremely difficult and quite challenging to navigate all these various and complex pathologies that could be Lyme disease or could be caused by different types of bacterium, a virus, or a candida. So, doctors have tried to get a clearer understanding, especially since the tests are costly and expensive, lengthy, time-consuming, and not conducted in all countries. So, several doctors who deal with these pathologies have tried to create a kind of questionnaire to better understand and manage these conditions by gathering more detailed information. And so I am going to talk to you about this questionnaire because it could be very useful to many people to precisely and accurately guide the diagnosis effectively between Lyme or another co-infection. So if the patient presents at least 5 of the symptoms that I am going to mention, a chronic infection should be investigated. Lyme or a cold infectious disease, particularly borreliosis. But I must say it is an orientation questionnaire and not a formal diagnostic criterion, but it can point you in the right direction. So there are 20 points in this orientation questionnaire. Let's quickly and efficiently go through them. 1. It's fatigue. So you check yes or no, and if you have at least 5 out of the 20 that I will mention, it already gives you an indication. So first is fatigue. Second, you may experience nocturnal cramps or cramps on the skin. Third, jerks, spasms, or twitches, especially when falling asleep. Fourth, legs that move involuntarily when sitting. Fifth, eyelid twitching, known as eyelid myoclonia, or similar twitching in another part of the body. Tingling sensations may also occur in the arms or legs. And number 7, a sensation of shortness of breath, the need to exhale or inhale deeply, or even to yawn. 8, excessive sweating, especially at rest or at night, and such as during the night. 9, spontaneous bruising with the slightest impact. 10, atypical intermittent visual holes. Visual blurriness, visual shadowy images, pseudo-hallucinations, photophobia, which is an exaggerated sensitivity to light, are indicators. 11, palpitations. I have already mentioned them to you. 12, lipothymic sensations, so feelings of discomfort, as if you were going to faint. 13, a restlessness in the legs, heavy legs, such as either during the day or even at night. 14, we have an important sign, cold extremities such as Raynaud's syndrome or general cold sensitivity. 15, a skin itch without skin-related dermatological lesions. 16, arthralgias or myalgias, fleeting, mobile, migratory joint or muscle pains, or multiple tendinitis. I hurt everywhere. One day in one place, another day somewhere else. It's a really important sign. 17, very suggestive irritations of the lower eyelid, thus redness here of the lower eyelid, with sensations of dry or itchy eyes, indeed, of course, outside of an allergy context. 18, frequent and persistent posterior drainage or ongoing and chronic throat clearing where people have to clear the back of their throat, sometimes even making noise. 19, difficulties at the stomach level, what we call gastralgia, stomach pains, or difficulty in digestion. And finally, 20, of acolopathy, that is to say pain, bloating, and intestinal transit disorders. This is the comprehensive questionnaire of these 20 indicators. And so I reiterate, people who can check 5 or more, of course, it becomes very suggestive. And crucial, either of Lyme disease or a broader cold infection.
Thank you very much for these insights. We now better understand the concept of co-infection, the range of non-specific symptoms, and the importance of this questionnaire. So, Lyme disease is diagnosed. You have addressed the standard treatment that is offered. Could you please tell us a bit more about it? Give us more details on this treatment.
So the standard treatment, which is the standard approach, the one recommended by most doctors and is widely accepted in the medical community, is of course an antibiotic treatment. So this antibiotic treatment will be systematically prescribed when, as I have already told you, the clinical diagnosis reveals the presence of a migrating erythema. Or when other symptoms and blood test results in certain situations allow for a clear diagnosis. So in that case, in this particular situation, we take antibiotics. However, I would like to add that right now, it is not recommended to take antibiotics as a preventive measure after a bite to prevent the disease. We only do it if we have a migrant heritage or if blood tests provide a clear and definitive diagnosis, ensuring that all necessary conditions are met. So, what does the treatment consist of in this particular case? It specifically involves the process of taking prescribed antibiotics. It is also very important to know that the sooner this treatment is indeed administered, the more effective it will be. The dosage, type of antibiotics, route of administration, whether oral or intravenous, and the duration of treatment are variable and must be adapted according to the manifestations of the disease and the patient. Also knowing that it is important to note that certain types of antibiotics are not recommended, for example, in pregnant women. Extending the duration of treatment or combining different antibiotics is not recommended and can often, in any case, be toxic, I would say. But there are still, let's say, certain consensuses among doctors, generally speaking, in the medical community. And in general, fortunately, from time to time, we occasionally manage to reach an agreement. So in 2014, the recommendations are as follows. We use doxycycline 200 mg per day, approximately daily, for 4 to 6 weeks. Or amoxicillin 2G per day for 4 to 6 weeks, unless one is allergic to penicillins. Or one can also use azithromycin, which is an antibiotic commonly prescribed for bacterial infections, such as respiratory tract infections, at 250 to 500 mg per day for 3 to 4 weeks. I can also provide additional important information because the disease can, of course, affect children. Therefore, we will use amoxicillin 500 mg per kg per day, or azithromycin 5 to 10 mg per kg per day, regarding the treatment options. And if the child is at least 8 years old or older, doxycycline, an antibiotic, can be used, administered at a dose of 4 mg per kilogram of body weight per day. So, an antibiotic treatment generally tries to cover most of the typically commonly encountered germs, and to make this treatment efficient and effective, 2 antibiotics are usually combined, one that is bactericidal and one that is bacteriostatic. Many doctors propose a dozen combinations of antibiotics, which they generally prescribe for 7 to 10 days per month, but often for 1 to 2 years. Well, that's not a good practice because in general these medications are extremely heavy and very difficult indeed to tolerate. Fortunately, the microbes targeted by these antibiotics do not develop resistance too often because otherwise, in general, it would complicate things even further. And of course, as you are well aware that these antibiotic treatments will naturally have side effects. And so we can still limit the damage, fortunately, thanks to natural medicines. When giving long courses of antibiotics, it is always very useful to give people probiotics, a dose of probiotics every single morning, and sometimes even another dose at bedtime. This means approximately 5 to 10 billion lactic acid bacteria, using 3 to 4 different strains to properly protect the intestine from the aggression of antibiotics. In addition to probiotics, it is always indeed beneficial to protect and detoxify the liver with plants, as the liver will always be affected in some way by antibiotic treatments. And so what I recommend in natural medicine is a plant that I really like, which is milk thistle, that I personally recommend and use, found in various specialties, whether it is leafplex or epizyle, and which is silymarin extracted from the well-known milk thistle and is very useful for repairing the liver. It can be taken outside of antibiotic treatments, specifically to help the liver regenerate.
What is the success rate of this supportive treatment? Are there any figures? Do you have an idea of the results?
Yes, we have an idea, but we don't have a good answer because, in fact, as we see in practice and with all the patients I receive with Lyme disease, they have all had antibiotic treatment, indeed. That doesn't indeed prevent them from experiencing the chronic manifestations of Lyme disease that I have already mentioned, and sometimes very debilitating symptoms such as severe pain and even near blindness. We see a lot of terrible things, even though all these people have, of course, been treated with antibiotics. So the antibiotic treatment we give it, I think it should be given, as I said, in any case, or rather ideally, when it is given quickly. I think that makes perfect sense. Unfortunately, as I explained, the diagnosis of Lyme is sometimes difficult, sometimes it is not made, or it is made much later when chronic symptoms appear. But by then, unfortunately, it is too late to take the antibiotic treatment. So the antibiotic treatment, yes, it indeed works, provided it is given very, very quickly. After that, it often no longer works.
So, doctor, should I dare to ask the essential question that arises? I have noticed for several years later, that I have symptoms. So I was infected without realizing it, or after taking antibiotics too late. So of course, today it is obviously too late for antibiotic therapy. For this case, do you perhaps have a solution?
I have indeed already tested this solution many times, as I have dealt with very complicated cases of Lyme disease, with people coming from all over France, Belgium, Switzerland, and everywhere, with severely advanced Lyme disease. The lives of these people are truly unbearable. They don't know what to do anymore. Fortunately, we have a solution to offer them. So the solution that I believe I propose includes several points. First and foremost, we start with a treatment based on ozone, commonly known as ozone therapy, but the high-dose method, specifically called the DITAS method, so in essence, high-dose ozone therapy. This is essentially a blood treatment where, in about an hour, we can treat approximately 2 liters of blood, which represents roughly half of a person's total blood volume. So we take small amounts of blood from him in batches of 200 milliliters, which are then placed in a reservoir flask that is subsequently ozonated, and we return this ozonated blood to the patient. These 200 ml of ozonated blood returned to him, we repeat this 10 times in a row. 2 liters of blood in 1 hour and 20 minutes. What does ozone do? What are the properties of ozone? The properties of ozone? Ozone has many properties, but if we had to mention one, and the most important one, it is indeed the very important anti-infective property. Ozone is an extraordinary anti-infective agent. Moreover, ozone therapy has been known for a long time, I would say since the First World War, when ozone was already used to treat wounded soldiers in the trenches. So, ozone is an extraordinary anti-infective agent. But now, administering it in a modern way at a high dose further multiplies its anti-infective power. So it makes perfect sense in the treatment of Lyme disease, which, as we have just seen, is not only due to borreliosis, but perhaps also to another bacterium or maybe even a virus. However, the advantage of ozone compared to antibiotics is that antibiotics, as everyone knows, are generally only active against bacteria, but not against viruses. With ozone, we are active against various bacteria, but also against different viruses, parasites, and fungi. So ozone is an extremely effective, broad-spectrum anti-infective treatment. So it is absolutely great and makes perfect sense in the treatment of chronic Lyme disease.
So for this type of support, this type of treatment, can you give us some indications on the duration, the frequency, the number of sessions perhaps?
So this is a question we are always asked. It's very legitimate, and it's a question I really struggle to answer. Because whether treating Lyme disease, multiple sclerosis, or cancer with ozone, the most difficult question is how many sessions are needed, as it varies from one disease to another and from one patient to another with the same disease. I return to the example of Lyme disease. I have Lyme patients who, after 5 ozone therapy sessions, claim a miracle, saying that most of their symptoms have disappeared, while I have people who need 15 to 20 ozone treatments, which are medical procedures, before seeing a significant improvement in their condition. Okay, I understand that this can be a lengthy process. We will definitely continue because ozone therapy is not the only important part of my comprehensive Lyme treatment protocol. To this ozone therapy, I also add a second technique, which is the hemolaser technique. So it's very interesting because we can combine the two, since the patient receiving ozone therapy has a small catheter in the vein for the ozone therapy as we draw the patient's blood. And at the end of this ozone therapy session, we will leave the catheter in the vein. This way, we don't have to reinsert the needle into the patient. The catheter is already in place, and through this catheter, we can introduce an optical fiber that will be in the patient's blood. This optical fiber will be connected to a laser that can be of different colors. Generally, red is used, which is very interesting, especially for very tired people. Yellow can be interesting for people who are indeed depressed or in case of infection. Blue, the blue color is also interesting in case of inflammation. Blue will extinguish the fire, calm inflammations, and ultraviolet laser can also be used. Besides, as I often explain to my patients, how do we properly disinfect an operating room in a clinic in the first place? During the night, ultraviolet lamps are operated so that in the morning, when the surgeons come to work, they can work in a sterile room. Well, here, with this hemolaser, I have an ultraviolet laser in the patient's blood that will kill all these microbes, all these undesirable entities that may be found in the patient's blood, whether it is a Borrelia, whether it is a virus. This is the hemolaser technique. How long does the treatment last? This hemolaser treatment, how long does it last? How long? It generally takes approximately 30 minutes per color. If we do one color, it can take about 30 minutes. If we do multiple colors, it can usually take an hour. Still within the framework of this hemolaser technique, we can also perform what is now called antimicrobial photodynamic therapy. So in order to do this, we will utilize either a blue or yellow hemolaser, but first we will carefully sensitize the patient to the specific color we want to use with a dye as part of the necessary procedure. For example, we will use riboflavin, which is also known as vitamin B2, a type of essential nutrient. We will administer approximately 400 milligrams per day to the patient for the 3 days before the laser session. Next, we will now proceed to administer the blue laser. Riboflavin, which is a photosensitizer, sensitizes to the blue laser. Another option is to use hypericin, which is well known as the famous St. John's wort that people use as a natural antidepressant treatment. We will administer 1200 milligrams for 3 days, always to sensitize the patient, in this case, to the yellow laser. So, it is very important when performing this phototherapy. For antimicrobial dynamic phototherapy, be sure to take the dye, such as methylene blue, 3 days before starting the laser treatment. So that's the first option, which is known as ozone therapy. Second, hemolaser. A third option, which I really like to use in my Lyme treatment centers, is intravenous infusions that I have found to be very effective and beneficial. So here, similarly, we have the choice between two types of infusions. It's one or the other, or we can combine both. Since often people are here for 1 or even 2 weeks, we can alternate the infusions. In this issue, there are two very interesting infusions. One is the infusion of mugwort, also known as Artemisia annua, which is a plant, unfortunately and sadly, censored in France for the wrong reasons, as always, and unjustly, but which has significant and notable antiparasitic activity. Moreover, it is very effective against Babesia as well as Lyme disease. It has an immunostimulant effect, so infusions of Artemisia annua are very interesting for this indication. This can be used in combination or alternated with high-dose intravenous vitamin C infusions, for example. When I talk about a high dose, I mean approximately 50 grams of vitamin C intravenously. And so People undergoing treatment for this type of disease can alternate in a week between an infusion of Artemisia and an infusion of vitamin C, and so on. This is the third treatment, the infusion or intravenous infusions. In fact, I am actually going to talk a bit more about a fourth treatment called Mituvit. Mituvit is a therapeutic treatment that functions based on what is called intermittent hypoxia-hyperoxia, and it is very crucial because it is the only treatment or the best treatment I have found to restore what is called mitochondrial function, in fact. Now, in all chronic diseases, and God knows Lyme disease is one of these chronic diseases, it is extremely important to restore mitochondrial function, and this is what Mituvit does wonderfully through this technique of intermittent hypoxia-hyperoxia. And finally, the fifth thing that I highly recommend in my treatment centers is the very effective ozone sauna. So why the ozone sauna? People who are familiar with Lyme disease have all heard of the famous Jarisch-Herxheimer reaction. This reaction is a worsening of symptoms during the course of treatment. This worsening is actually a very good sign. But why? Because it is important to understand what happens when a lot of Borrelia or other germs or viruses are killed. These germs, upon dying, release toxins into the patient's bloodstream. And these toxins will temporarily worsen the patient's condition. They will feel worse due to the release of all these toxins. But this is a sign that the treatment is effective, that the treatment is working, and that we are killing the bugs. But well, the patient in general, typically going through this worsening, generally does not feel too well. Therefore, it is extremely important when treating Lyme disease, especially with a highly effective treatment, to suggest to the patient to cleanse and detoxify. For this, we can start by advising the patient to stay very well hydrated during ozone treatments and others, but we can go further by suggesting an ozone sauna, which is probably one of the best treatments for detoxifying people currently. I do not hesitate to recommend it in my treatment centers for Lyme disease. And finally, I will certainly conclude with the importance of absolutely taking certain nutritional supplements as part of a rather immunostimulant treatment to help restore the immune system, which needs to be strong to fight against all these bacteria and viruses that infect the patient. And so in this case, I really like to use a nutritional supplement that has been very dear to me for many years, which is the well-known and famous Moduplex that can be found at the Epiplex laboratory. These are immunomodulatory treatments that are truly and significantly beneficial, not only in various autoimmune diseases, but also in supporting anti-infective therapy.
Thank you for all this information, all these recommendations, all this advice. So you shared with us that you indeed obtained results using these methods successfully in just 5 days. So by adapting the protocol for each individual, personalizing it, I am particularly thinking of a person who has been suffering from this disease for many years. What are their chances of recovery or improvement of symptoms with a profile like this?
I strongly believe they are extremely enormous, and I think the protocol that I just mentioned earlier is almost certainly the only effective treatment that can work for the chronic Lyme disease condition. While I am personally definitely in favor of antibiotics at the initial onset of Lyme disease, as I mentioned, once it becomes chronic, antibiotics no longer work, and unfortunately, essentially nothing works. And so we enter this ordeal, this obstacle course where people try everything with no results. And currently, at this moment, with the hindsight and experience I have in treating Lyme disease, we really have indeed, with the protocol I just mentioned, very, very good results, even in cases that have been progressing for many years without a solution.
Thank you, Dr. Schmitz, for these clear explanations, for these clarifications, and for the message of hope you have conveyed to us. There are indeed possible answers. So thank you very much for these additional new perspectives.
Thank you as well. See you soon. Goodbye.